And I'm just going to show a 360 view of the room. It's just a calendar. I'm going to perform some hand hygiene. I'm going to go wipe my stethoscope. And I'm going to apply my gloves, okay? And I'm going to check patient ID. So can you just tell me your name and date of birth, please? Perfect. So everything matches. So hi, my name is Michaela. I am a student nurse here at the hospital. I'm going to do a physical assessment on you, okay? Is that okay? Perfect. Okay, so before we begin, I'm just going to close the curtain to provide some privacy. And then I'm going to ask you if you're comfortable. Do you need to use the restroom at all? You're okay? Perfect. So I'm going to check your ears. I'm going to inspect them so they are symmetrical and equal bilaterally. There's no discharge coming from them. And I'm just going to palpate the auricle and the tragus. There's no tenderness. And your nose, when inspecting, it is midline. There's no discharge or crusting around. And I'm going to palpate the frontal and maxillary sinus. Did you feel any pain? Okay, and there's also no tenderness. Now for your inspecting your lips, they are in good color and they are symmetrical and they look hydrated. So I'm just going to get you to open your mouth. So your gums are pink and there's no bleeding. And your teeth are evenly distributed and there's no looseness, which is good. Tongue is symmetrical and hydrated. And then can I just get you to touch your tongue to the roof of your mouth so I can check the base of your tongue? Perfect. So it has good color and there are no lesions. And then can I just get you to relax your tongue and then open your mouth? So soft and hard palate are intact and there are no lesions. Now to check for cranial nerve number 9 and 10. I just get you to open your mouth wide and say, ah. Perfect. So the uvula and the soft palate moved up and back, which means that they are intact. And cranial nerve number 11 hypoglossal. Can you open your mouth for me? Tongue is midline. And then can you move your tongue from side to side for me? Perfect. And now I'm just going to get you to repeat a few words, okay? So light, tight, dynamite. Go ahead. Perfect. So there are no tremors, which means this cranial nerve is intact. And now I'm going to inspect your neck. So the neck is midline, symmetrical, there's no scarring, no lesions, and color is consistent with genetic background. Now I'm going to palpate it. So there's no tenderness, it's warm, and there's no visible masses. And I'm going to palpate the carotid artery, only one at a time. So the grade strength is about a +2. Rhythm is regular and equal bilaterally. After that, we're going to do cranial nerve number 12 to check your spinal and spinal accessory, okay? So I'm going to get you to move your head to this side while I apply resistance. So go ahead. Good. And now the other side. Good. Good. And now I'm going to get you to shrug your shoulders, okay? With resistance. Perfect. To check the upper extremities, can you just roll up your sleeve for me? Perfect. So I'm not seeing any involuntary movements. There's no lesions, no scarring, and no deformities. Now I'm going to palpate. Do you feel any pain? No. And there's no tenderness. No lesions. Temperature is warm and skin color is consistent with the genetic background. Now can I just take a look at your nails? So they're curved, smooth, clean, and there are no lesions, which is good. Now we're going to do some range of motion, okay? So I'm going to get you to flex your fingers, extend your fingers, flex your wrist, extend your wrist, radial deviation, and now flex your elbows, extend your elbows, shrug your shoulders, abduct your shoulders, adduct your shoulders. Good. Did you feel any pain while you did that? No, you're okay? Perfect. And now we're going to check your lungs. So I'm going to inspect your posterior thorax. I'm just going to get you to turn around and roll at the back of your shirt. Perfect. So there's no skeletal deformities. It's symmetrical. There are no lesions, no scarring, no pulsations. So I'm going to palpate your back. So there's no tenderness, no lesions. Do you feel any pain? Can you take a deep breath for me? Perfect. So there's symmetrical chest expansion. And now we're going to auscultate. So 1, good. So there's no wheezing or crackling. And anterior posterior transverse ratio is a 1:2. And for anterior thorax, the rate is 15 breaths per minute, rhythm is regular, and quality of respirations is smooth, even, and effortless.